agents that led the planning process for people to successfully navigate from certified housing or family home to independent living arrangement. So we have two wonderful speakers today. Please make best use of them. And thank you so much, Sid and Carol, for taking out time for today. And the floor is yours. Thank you.
I'm sorry. Before starting, I see that the Zoom user raised the hand. Did you have any question? Someone have typed in the chat. 这边有中文的，你点击地球仪，然后那边选中文就有同声翻译。Zoom user, could you unmute yourself? What is your question? I see you raise your hand.
请问点了没有用啊？好像。
哦，点了没有用？
对，点了中文没有？是有中文的翻译还是有中文的字幕啊？
有中文翻译，可能刚刚中文的还没有在说话，有可能。
哦 ，OK， 谢谢。
我看到金大里他有在说话，应该是能听到的。Zoom user 是哪一位？你有问题吗？如果没有问题，就把手放下来啊。
可以听到，可以听到，谢谢。
OK， 好。Yes, go ahead. Sorry.
Shall we start? Okay, fantastic. Seth, do you mind sharing your screen? Thank you so much. Thank you for the invitation to speak with this group. And thank you so much for the kind, warm welcoming. So I just wanted to kind of pause here. As I was introduced, my name is Carol Napierski. I work for New York Alliance for Inclusion and Innovation. A lot of my work for the last 11 years has really focused in on independent housing and our journey to provide supports and services, including a lot of housing related information. We're stopping right here on the landing page of our PowerPoint slide. Top left-hand corner, you will find the logo for New York Alliance for Inclusion and Innovation. That's the association that I work with. We are a statewide association. Our members provide supports and services to individuals with intellectual and developmental disabilities. Top right-hand corner, you'll see the logo for the New York State Council, over 400 related resources for inclusive independent housing. So if you haven't had a chance to look at that, I highly recommend you do. So welcome to our presentation, A Housing Journey, Options and Resources. And let me kick it off to my colleague, Seth Greenman, for additional introductions.
Thank you, Carol. And I just want to echo what Carol said. I'm grateful to be here today with this group. And I hope it is a beneficial opportunity for you to connect to information and resources related to housing to support your loved one on their housing journey. I am, as I was introduced, I'm both a parent of a 17-year-old who receives OPWDD services and a professional working in this field. And so this work is important to me on both fronts. So I'm going to advance the slide. And in our presentation today, we're going to focus on three key areas. We want to first talk a little bit about housing options for those who receive OPWDD services. And so we'll talk generally and broadly about those options and eligibility for those. And then we will move into a section of the presentation on housing related services. And so we'll talk about things like the OPWDD housing subsidy. We'll talk about transition stipends for people who are moving for the first time, and a few other related services, including self-direction services. So we'll get into a variety of services that support people to live independently in housing of their choice. Then at the end of the presentation, we're going to highlight some of the resources that are available to you on the New York Housing Resource Center website at nyhrc.org. And so we'll touch on those as well. So let's start out with housing options. When people think of housing options for people with developmental disabilities, typically our first thought is the group home system and the group homes that are available. The traditional idea of group homes and small residential settings really started in the 1970s when the state began to form community residences and small bed intermediate care facilities, or ICFs. Then in the 1990s, when the Home and Community-Based Services waiver was approved, those residential settings, many of them, began to transition to what we know today as individualized residential alternatives, or IRAs, or group homes, as they're so often called. Many of these homes are single-family homes with multiple people living there. The average number of people in a group home is anywhere between 4 and 6 people on average, but they can be as small as 1 or 2 people and as large as 10. Typically, these are single-family homes with people occupying their own bedroom or sharing bedrooms in some cases, but they can also be apartment-style settings that are certified where people share or have their own apartment with centralized location for community space and community activities, staff functions, things like that. In addition to what we know as the group home system and the IRAs, there are settings that we refer to as family care. And these are settings where a person receiving OPWDD services lives with a family who they're not related to, and that family receives a stipend for them to live there. So it's akin to adult foster care. And there are a number of people living in family care settings across New York State. But most people in certified settings live in what we call individualized residential alternatives, or IRAs. There are benefits to the group home system that exists. So when people move into a group home, they are integrating many different services into one single service, which can be positive or negative, depending on how you look at it. So when someone is eligible and moves into a group home, they have their housing, the provision of their housing, as well as their staffing, is integrated into one service that's provided by that agency. Additionally, the agency receives funding to also integrate clinical services. That could be nursing services, therapeutic services, or behavioral services. And so one of the benefits of the way that the certified system is structured is to provide integrated service model with those various opportunities. The agency or the state, whoever is operating the group home, is responsible to provide the staffing and maintain the home. Some of the challenges, however, that people encounter with certified residential opportunities is that when the person moves into that group home, they have little or no control over where and with who they live. So they have very little control over their housemates or their roommates. They also have little to no control over the staff that support them, as the agency makes those decisions related to staffing and residential placements. Additionally, the Certified Residential Opportunities System operates on what's called a needs-based protocol. It is not a formal wait list. And so for many people who are living in a stable setting, they might apply for one of these, but it may be many, many years before an opportunity becomes available. Additionally, the certified residential system is very expensive to maintain. And so the state has not stopped development of certified settings, but has significantly limited the number of certified settings that are being developed because of the cost to implement these services. Currently, the state budget is a little over $10 billion, and about 2/3 of it, or $6 billion, is related to certified settings. As I mentioned, certified settings operate on a needs-based system for those who are interested in those opportunities, not a formal wait list. It is often referred to as a wait list, but it doesn't operate as a wait list. It's not first come, first serve. So If you or your loved one are interested in a certified setting, you would work with your care manager to submit an application. And when you do so, you will be assigned a level of need based upon several different factors. Those 3 levels of needs are highlighted on the slide for you. So when someone applies to be considered for a certified setting, if they are homeless or at immediate risk of homelessness, or they're immediate health or safety risk to others. Maybe they don't have a caregiver, or they're leaving a hospital or an incarceration setting, like a jail or a prison. In those cases, they would be assigned an emergency level of need, and they would be considered first for any group home vacancies that exist. If their level of need doesn't rise to that level, maybe they're at an increased risk of homelessness, but they're not at an immediate risk, or they're beginning to have an increased risk to self or others of health or safety. Maybe they're living with aging caregivers, so they still have a caregiver, but that person is aging. Or if they're leaving a residential school, a developmental center, or a skilled nursing facility, then they could be considered substantial need. Everybody else, whoever doesn't rise to those 2 levels of need, is assigned current need, or level 3. And so when the provider agencies who operate group homes have a vacancy, they work with their local developmental disabilities regional office, their OPWDD office, in order to look at first the emergency need list and who rises to that level, to evaluate if anyone on the emergency need list is appropriate for the vacancy that they have in the group home. From there, if there's no one on the emergency need list that is appropriate to fit the vacancy that's available, then they would look at the substantial need list, and then from there, the current need. And that's how the current system operates. So it's important to understand, because sometimes as parents, we think that if we just apply and we get our loved one on that list, that it's going to come up, right? It's a wait list. But no, it doesn't operate that way. It does depend upon level of need and the vacancies that exist, and whether those vacancies are appropriate for our loved one. If you want additional information on certified settings and how the Certified Residential Opportunities Program operates, you can find that on the New York Housing Resource Center website. We also have a link on the slide to the guidance document that OPWDD uses for this service. For most of the rest of the presentation today, I'm going to focus on what we call non-certified housing. So we've talked a little bit about certified, and you can find more information on that. But for many people, non-certified housing is becoming the increased focus area when we think about long-term planning and independent living. Non-certified housing is not an official term. It's just housing. It could be an apartment, that it could be a market rate apartment, or it could be an apartment that is considered income-based or affordable. Maybe the property was developed with tax credits or other grants in order to bring down the cost of the rent to a more affordable level. It's still not always affordable, but it's typically at a cheaper rate than the market rate housing around it. Non-certified housing could be a family-owned property. It could be a duplex where family lives on one side and the person receiving services lives on the other. It could be an accessory dwelling unit, which is a unit that is attached or adjacent to a single-family home. Or it could be a situation called shared living, which we'll talk a little bit more about, which involves the person who receives services living with a paid caregiver. And so non-certified housing can be any of these. Just like maybe you and I, we live in non-certified housing, and we all live in settings that are very different. Maybe someone lives in a condo or a co-op. There's a lot of different opportunities for non-certified housing. Some of the benefits of non-certified housing is that it does provide increased control over where you live, both where you live as well as who you live with. So the person who's planning for non-certified housing, the provision of housing and the provision of staffing are separated. And so they can decide who do I want to support me in this apartment or in this house? And who do I want to live with in this house? And so there's a lot more planning involved, but it does provide more control over where people live and who supports them to live there. It also provides more control over finances. The person's social security and other benefits don't go to a provider agency, they go to the person, and you develop a budget that makes sense for you. Additionally, as more and more people are self-directing their services, the approach of self-direction aligns really well with non-certified housing. And so people will use a variety of services through self-direction to support them to live in their own home. There are still challenges with non-certified housing as well. One of the challenges is where to live, right? We all face the affordable housing crisis that exists all across this country, and certainly in New York City, finding housing is very difficult. And so anyone who's seeking to identify opportunities to live in their own place in non-certified housing, they have to face this question of where to live. It may not always be where they want. Where they want to live may not be affordable, and they may have to adjust or think differently about where they want to live to meet both their needs financially as well as their service needs. Sometimes in non-certified housing, it is also more difficult to integrate medical supports or behavioral supports. However, it can be done. It just takes planning and thought in how to do that. Also, with non-certified housing, there's not the established safety net where the agency typically commits to providing staffing. So it takes a lot of planning. And so one of the primary challenges with non-certified housing that families encounter is, how do I plan for this? What do I need to know? Not just where I live, but how is my son, my daughter, my loved one going to be supported long-term in this housing option? And that's where the work that we do with the New York Housing Resource Center comes in, as we seek to provide good information related to housing planning so you know how to make a plan that works for you or your loved one. As I mentioned, more and more people are considering non-certified housing, as there's a significant body of research at this point that highlights that smaller settings lead to better life outcomes. When people have more choice over where they live and with who they live and the autonomy to make those choices, their quality of life indicators have typically improved based upon research. Additionally, we've been able to show that people with complex needs can live independently. It does take a lot of planning and a lot of support, but it is possible. We all know that there is a shortage of people who are willing to work as direct support professionals. Some people call it a crisis, but it's been a chronic shortage for a long period of time now, and it's not necessarily going away anytime soon. And so when we think about certified settings in group homes that operate on a 24/7 shift-based staff rotation, those are unsustainable considering the chronic DSP shortage. And so we have to think differently how to provide housing and services for people with developmental disabilities so that they can live better qualities of life and receive the support that they need. One of those ways is through technology. And as technology options are increasing in their availability, as they are decreasing in their cost, and as the state invests in technology options for people with developmental disabilities, this is becoming an increased focus related to housing planning. How can technology support people and replace the need for staffing to be present or a support person to be present? And so that's something to consider as well. As we work through our presentation today, I think it's important to share a few terms. I've already used a few of these, and so I apologize for these definitions being later in the presentation. But we will talk about affordable housing. And affordable housing can mean two different things. It can mean affordable on the developer side. And so the property manager, the developer, considers it affordable, typically when there has been support to develop the property, often through low-income housing tax credits and other federal and state financing, in order to be able to provide the rents that are reduced from the market rate rents and are aligned with area median incomes. And so whenever housing has been developed that way, it's considered affordable. That doesn't always make it affordable. And sometimes people can and still need other forms of rental assistance to be able to meet the requirements and pay the rent for those properties. But typically, the rents at affordable housing projects are reduced based upon the area median income. For a person who's looking for housing, affordable typically means they're only paying about 30 up to 40% of their income towards household housing costs. And so that's a marker that's often used by rental assistance programs in order to decide if something is affordable for that person. Supportive housing is simply affordable housing with on-site services. OPWDD has a little bit of supportive housing, and we'll talk about that. This is really popular within OMH services, the Office of Mental Health, which has invested significantly in supportive housing, where there will be an affordable housing project with on-site services such as medical supports, clinical supports. Maybe there's case management on site or some other staff person to give direction and support with what people need who live there. And so that's supportive housing. Sometimes we hear the term supported housing, and that just means the rent is supported. And that's like through rental assistance programs like Section 8 or the OPWDD housing subsidy. Public housing is affordable housing that's owned by a public housing authority. So not all affordable housing is public housing. Affordable housing might be owned by for-profit or not-for-profit developers and property management companies. It is not necessarily public housing. It's only public housing if it's owned by a public housing authority. Finally, there's market rate housing, which are market rate apartments or single family homes, duplexes, triplexes, condos, co-ops, and that the rents are set by a landlord based upon how much the unit is worth in the market. I mentioned that OPWDD has invested in supportive housing. And so over 10 years ago, OPWDD began committing a portion of their budget each year to the development of affordable housing units within larger multifamily projects, and with the commitment that those units would be set aside for people with developmental disabilities. So this is a partnership between OPWDD and the New York State Homes and Community Renewal, or HCR, which is the primary financer of affordable and supportive housing projects in New York State. All of the funding for affordable and supportive housing projects from the federal government and state initiatives will pass through HCR. And so OPW has partnered with HCR, and they've committed each year to providing $15 million towards the development of these units. And it's the development, so it's a capital dollars where OPWDD will pay for half of the unit that is going to be set aside for people with developmental disabilities. And so all across the state, there are affordable multifamily housing projects where a portion of the units are set aside for people with OPWDD eligibility. OPWDD does have a list on their website of these projects, but often it can still be difficult for people to identify where are these and are there units available. And so we often recommend that you work with your care manager or your care manager supervisor to let them know that you are interested in learning more about these units and getting information on what's available in your area. We also have some information on the New York Housing Resource Center that you can access as well, related to integrated supportive housing. In the development of this housing, the developer builds a partnership with a OPWDD provider agency who agrees to be the agency attached to the project and maintain an ongoing relationship to support the people who live there. Now, the people who live there with developmental disabilities don't need to receive services from that provider agency. They can receive services from whichever agency they want. However, there is an agency attached to the project in order to provide support on an ongoing basis, and that's integrated supportive housing. Additionally, we mentioned that some people are approaching housing planning from a shared living approach. Sometimes people will call it a model, but there's not really any one model of shared living. It's really an approach in how we think about independent living. And this is where the person who receives services and has the developmental disability will live with or live near a paid caregiver. Oftentimes now people are approaching shared living through self-direction because there are certain services within self-direction that directly align and support a shared living approach. And we'll talk a little bit about these later on, but these are things like a paid neighbor, which is a live near support, or someone who is on call to provide support for that person. Or it could be what's called a living caregiver service, which is the live with support. And that's where the person who receives services, the caregiver lives with them in their home and is there for fellowship and protection. There is a lot more information on shared living on the New York Housing Resource Center website. We have a whole series on shared living where you can hear different stories that people who have lived independently through shared living tell their experiences, their lived experiences. And so you can hear their stories, or you can learn about some of the services that support shared living. And so that link is there for you on the slide to bring you to those resources. Additionally, we have what's called a shared living toolkit. And this is, it's a collection of information to support people who receive services, and especially the agencies who support them, on how to support shared living approaches. So the first 16 pages or so is an introduction to shared living, and it's an excellent resource. The rest of the toolkit, it's about 100 pages, are legal documents and research that was done to show how agencies can support shared living and support people to live with a caregiver who's maybe not paid to sleep there, but is paid during the day to provide services. And so there's a lot more information there that we won't go into today. You can certainly ask questions about that. We have the shared living toolkit on the New York Housing Resource Center in English. We also have it available now in Korean and simplified Chinese. We distributed that to Cindy ahead of time, so you can get a copy of that as well. So I've covered really a general overview of housing options, from certified settings to various approaches with non-certified housing, including shared living, integrated supportive housing. Now I want to get into a few housing-related services that people with developmental disabilities can access in order to support their plans to live independently. So all of these services, which I'm about to talk about, are not for people who are living in certified settings. These are for people who are seeking to live in a non-certified setting and be legally and financially responsible for their unit. So the first is the OPWDD housing subsidy. This is a rental assistance program that's modeled after the Section 8 Housing Choice Voucher Program that's administered by HUD through local public housing authorities. These housing subsidies are portable. It is a state-funded service, and so that means that someone does not have to be eligible for the Home and Community-Based Services waiver in order to receive this service. They just have to have OPWDD eligibility. So as long as they have established OPWDD eligibility and they're 18 years or older, and they're legally and financially responsible for their living situation, then they're eligible for this service. And legally financially responsible simply means that they are a tenant on the lease, or they are a homeowner and they're on the deed and responsible for paying the mortgage of that home. And so if they are a homeowner or they are a tenant and they're legally and financially responsible, then they're eligible for the OPWDD housing subsidy. It is portable, but depending upon where you live in the state, you will be eligible for different amounts of rental assistance. And that's because, similar to the Section 8 Housing Choice Voucher Program, OPWDD uses what they call maximum payment standards in order to identify the maximum amount per county that people would be eligible for rental assistance through this program. Those payment standards are set to match the HUD FMR values, or fair market rent values, that also govern the Section 8 Housing Choice Voucher Program. And so each county of the state, you'd be eligible for a different amount of rental assistance. The OPWDD housing subsidy is governed by an ADM, an Administrative Directive Memorandum, which is a guidance document that was issued in 2022. And so you can learn more about that by reading that guidance document or checking out our resources that we have available on the New York Housing Resource Center. So if you visit the New York Housing Resource Center and go to housing types and funding and then rental assistance, you'll find a lot of information on the OPWDD housing subsidy. Now, a lot of people ask about the OPWDD housing subsidy and whether or not their child is eligible for it while still living with them. And the answer is yes and no. It depends, right? So if your loved one is living with you in your own housing and they're not legally and financially responsible for it, then they're not eligible for the subsidy. If you own a single family home and they're just renting a room from you, then they're not eligible for the subsidy. But if you and your adult child who that you want to live together and you both are on the lease as legal tenants, then you can live with your child and they can still receive the subsidy because they're legally and financially responsible for the unit. So it's not so much an issue of living with a parent as it is whether or not your loved one is legally and financially responsible for the unit. And I've said that enough times, right? But that's the key aspect to think about there. The guidance from OPWDD outlines some additional allowable housing criteria that it's important to know and follow. For example, the housing option has to pass a checklist called the QA checklist or the Quality Assurance Checklist. And those are safety and health standards that are modeled after the Housing Choice Vouchers quality standards set that are used by HUD for the Housing Choice Voucher Program. And so there's a checklist that has to be followed and other allowable housing criteria as well. So you can check that out there. Often people ask, well, where do I begin? How do I access a subsidy? How do I apply for it? And really you want to connect with your loved one's care manager and have a conversation with them in order to start this process. Also, if you are self-directing services, then you can talk to the broker and FI about this as well. Everybody has a little bit of a different role in the housing application, housing search, and maintaining housing and that whole process. And so you want to have a conversation with the circle of support around your interests and your loved one's interest in living independently and how they can access this subsidy. Unfortunately, sometimes, and I know this from personal experience, when you talk to your care manager or you talk to your broker, especially if they're newer in the field, they may not have all the information or they may not be familiar with the process. So what should you do? I would encourage you to reach out to the care manager supervisor or your fiscal intermediary in order to ask questions if you're not getting those questions answered directly from the care manager themselves. Typically, within the life plan, it lists both the care manager supervisor, and then a regional director. Those are all contacts that you can follow up with if you're not getting the answers that you need. Additionally, you can contact your local regional office through OPWDD if you need help as well. Okay. In addition to the subsidy, there are what's called transition stipends. These are services that are available, again, for people who are OPWDD eligible and at least 18 years or older and are moving to a non-certified living arrangement. So if they're moving into a certified group home, they're not eligible for a transition stipend. They have to be seeking to live independently in a non-certified setting, and they have to be legally and financially responsible for the unit. Okay. And if that's the case, then they're eligible for a transition stipend. A transition stipend will fund basic and necessary expenses for them to establish their home for the first time. So that's things like a security deposit, bedroom furniture, kitchenware, lamps, rugs, a table and chairs, dishes, all of that stuff. And so this will fund those. When the person becomes eligible for this, they must spend this money and make these expenses within a 180-day window. So it's 90 days before the move and up to 90 days after the move. So it is a time-limited service, which is very important to know. We've had people reach out to us 6 months after they move, a year after they move, and they ask, how can I get the transition stipend? And you can't now, right? You have to do it at the time of the move. You have to do it within the 90 days before or after. And so it's really important to have conversations with your care manager, your fiscal intermediary, your support broker, if this is something you're interested in doing. There are two different types of transition stipends. The primary difference between the two is where the person is moving from. So if they're moving from a Medicaid funded setting, a certified setting, so that could be a group home, it could be a nursing home, it could be a developmental center, a residential school. If they're moving from a Medicaid funded setting, then they're eligible for what's called CTS, or Community Transition Services. And that's up to $5,000 to pay for the security deposit and to furnish the home. If they're moving from a family home into their own apartment or other independent living arrangement where they're legally and financially responsible, then they would be eligible for what's called the OPWDD transition stipend, which is $3,000 for household items plus the security deposit on top of that. Okay. And so there's two different transition stipends. Key difference, there's other differences, but the key one to remember is it's where you're moving from. We have a lot more information on transition stipends, including a webinar and links to additional resources on the New York Housing Resource Center that you can access. Those are under the resource category support services, and you'll see the topic OPWDD transition stipends, and you can access this information there. When we think about housing planning for independent living, so we have rental assistance through the OPWDD housing subsidy, we have funding to set up the home for the first time through the transition stipends. But one of the key areas that we need to plan for is related to the staffing supports. When someone is identified, I want to live in my own place, I want my own apartment, I want to live in a duplex, a co-op. Well, how are they going to be supported to live there, and what support do they need? One of the primary services that supports people to live independently in non-certified housing is community habilitation, or COMHAB. This COMHAB can be provided through a self-direction budget, or it can be accessed directly from an agency that provides the services. There's slightly different types of community hab that's available depending on how you're accessing it, with key differences between them, but it all falls under the community habilitation regulations of OPWDD. So there's COMHAB that can be purchased directly from an agency. That might be called direct provider purchased or agency supported COMHAB. It could be in a self-direction budget. It could be outside of self-direction if the person is not self-directing. And so that's an option that anyone can access who has OPWDD eligibility and is enrolled in the Home and Community-Based Services waiver, or the HCBS waiver. If someone is self-directing, then they can also choose to self-hire their community hab staff. This gives the person who's self-directing much more control over the wage for that staff. So you can set higher pay rates. You can interview and hire your own staff and train them, and there's less involvement from the agency. So it gives much more control to the person and their support system. The challenge with that is that there's less involvement from the agency. So you have to make sure there's a good plan to support that person with managing their staff, both hiring and managing and training and bringing correction if there's mistakes made. And that it is a lot of work, but many people do it successfully all across the state. In addition to the funding for community habilitation, there's also funding through the Department of Health for CDPAP services. This is a type of self-hire staffing that hires aides to provide support to a person who has various adaptive needs within their independent living setting. And so there is funding for that as well through the Department of Health. These are forms of paid staffing, but whenever we talk about with groups about planning for housing, one of the things that we like to bring up is the importance of the community or the circle of support around that person. That's not just paid, but it's everyone that supports that person, that interacts with them, and that provides that true circle of support. So not a circle of support that sits at a life plan meeting, but a circle of support that's involved in the day-to-day activities of that person and that is integral to their success in living independently. And so we always add this to the slide. While it's not true staffing supports that are paid through a service, often it's that community, that circle of support, or what we call their social capital, that will really make or break a plan for housing. We mentioned that when someone is thinking about living independently in their own place and thinking about non-certified housing options, that these tend to align directly with a self-direction approach to services. Often when people come to us and they are talking about housing planning, if they're not self-directing, we will recommend that they consider self-directing their services, because there are a number of services within self-direction that are only available through self-direction. They're not available outside of that. And so it's really important to consider whether this is the right path for you or your loved one. So let me just highlight a couple of those services. Within self-direction, there's a category of service called individual directed goods and services. Within that, there are a variety of different services that fall within IDGS, for short, that people can access. They can receive funding for community classes. They can receive funding for health club memberships and other community-based memberships. Some of the ones directly related to housing are a paid neighbor. So we mentioned this earlier with shared living. This is funding for a person to be on call. So the person who's living independently, who's receiving services, has someone that they can call. Maybe it's on nights or on weekends, depending upon the agreement that's set up. And they can call them if they have concerns, if there's issues that come up in their apartment with maintenance or with neighbors or with their landlord, or they're not sure what to do about their meal plan, or there's an issue with the stove, right? That they can call this person and they will be available to them. So this person receives a stipend to be on call. And then they're also typically hired as a self-hire community hab staff. I think they have to be, actually. They have to be hired as a community hab staff. And so they can show up and provide services through community hab as well if the person needs it. It's a great service that many people incorporate into their housing plans to live independently. Another category is housing related items and services. So this is where people can fund various goods or services to support them with their goal of living independently. So they have to be related to health or safety or increase the person's independence. But it could be things like a cleaning service. Maybe the person really needs support with a deep cleaning every month or every couple months. And so they hire a service and it gets paid through their self-direction budget. It could be things like some appliances. Maybe the person identifies they really need certain appliances to help them live more independently, and those could be paid for through this service as well. For people who are, maybe renting a home where you have to think about lawn care or snow removal, those services could be paid through IDGS also. In addition to IDGS, there's a category of service called Other Than Personal Services, or OTPS. And there are a number of different service categories under OTPS that support independent living. Now, OTPS as a category is capped at $3,000 per year, per budget year. So it's not a lot of money for all of the different services you can incorporate here. But it's important to consider. So things like a cell phone bill, or an internet bill, those could be built into OTPS and reimbursed. So it reduces the person's out-of-pocket expenses when they're living independently. Utilities can be reimbursed through OTPS. If someone doesn't receive enough through SNAP to cover their food costs, they can reimburse those food costs through a board stipend with OTPS as well. There's a category called personal use transportation. So this could be bus passes or Uber or Lyft services, paratransit services that the person uses in order to get to work or to other activities. And those could be reimbursed through OTPS as well. Finally, we mentioned when we talked about shared living that there is a service called Live-In Caregiver. And this is a service where a paid provider, a staff member, lives with the person who's living independently in their home. Now, the Live-In Caregiver cannot be related to the person receiving services by blood or marriage, which makes it difficult. So a parent can't be a live-in caregiver, a brother or sister cannot be a live-in caregiver. And so they can't be related by blood or marriage. But there are people across the state who are using this service to identify someone who lives with them in their home. and is there present in certain hours of the day based upon an agreement. Typically, and we recommend, the living caregiver is also an employee for that person who provides ComHab. So maybe they provide some ComHab in the morning when the person first gets up, and then maybe they provide some community hab in the evening hours as the person prepares for bed. But then that living caregiver lives there and spends the night and maybe doesn't get paid to sleep there during the night based upon their agreement. But what the living caregiver receives is free room and board to live there. And so there's stipends available through the self-direction budget in order to provide free room and board to the living caregiver to live with the person who receives services. The living caregiver can be a complicated service to implement, and not all fiscal intermediaries across the state will provide this service. So it's important to ask questions of your support broker and your fiscal intermediary if you're interested in the living caregiver, and find someone with the experience with this service that you can work with. We have more information available on the New York Housing Resource Center website if you're interested in exploring living caregiver and other self-direction services. We also mentioned housing navigation. And so housing navigation is a time-limited service where you work with someone who's received training. So the New York Alliance for Inclusion and Innovation, and we mentioned this in the introductions, has been providing training to housing navigators since 2015. It is a 30-plus hour course that provides intensive training related to housing planning and how various things interact with a person's housing options, from affordable housing and how housing is developed, to self-direction services and OPW services and other support services, to public benefits and protected savings accounts and Social Security. And it brings together the person's finances, the person's support services and their needs to identify an appropriate housing plan for that person and to help them find and sustain that housing. Housing navigation can be funded through self-direction. It is not a service that is directly funded by OPWDD at this time, but it can be indirectly funded through self-direction. That could be through a community habilitation, through a broker who's also a housing navigator, or as a contract service through Other Than Personal Services, or OTPS. We have a lot more information on housing navigation on the website, so I'm not going to cover it further here. But you can check that out under housing planning, resource category housing planning, and look for the topic housing navigation. We provide some videos on it, some introductory material. We talk about how you can reimburse for housing navigation, and we also link out to the housing navigation course material as well. Often, though, families reach out to us and say, I'm having a hard time finding a housing navigator. And that's true, because we continue to advocate for OPWDD to fund housing navigation. That hasn't happened yet. And so often, housing navigators who have been trained are working within their current capacity in a different part of the field. So maybe they're a fiscal intermediary and they're also a housing navigator, or they're a support broker and they're also a housing navigator. We've actually been training a lot of care managers in the past few courses. And that might be a care manager supervisor or a clinical staff with a care coordination organization. And so there are a number of provider agencies and care coordination organizations across the state who have staff employed for them who are trained in housing navigation and have that experience. So what I often recommend for people who are interested in working with a housing navigator is that you reach out to the service providers that you work with right now. Reach out to the provider agency, reach out to the CCO and say, I'm interested in working with a housing navigator. I'm interested in talking to the people in your agency who have experience with this. Do you have anyone, and can I connect with them? And that's a good place to start. If you continue to run into barriers with finding people to support you and accessing this service, you can always reach out to us. We do have a directory, but it is somewhat limited because, as I said, many people are working within their current capacities at this time. Okay, so in the last few minutes, I've been talking a lot about the New York Housing Resource Center. And so I want to show a few slides on that topic, and then we can move into the Q&A portion of the presentation. So if you visit nyhrc.org, you will see the homepage of the New York Housing Resource Center. And this is kind of a snapshot there of the page. And so you'll see the house there, the roof as the header of the page. This is a project, it was originally started in 2015. And at the time, there was a small balancing incentives program grant that was used to bring together a statewide housing task force to look at housing issues for people with developmental disabilities. And at the time, it was recognized that there wasn't a single place where people could go to get good information related to housing and housing related services. And so the New York Housing Resource Center was born at that time. It was a small, modest investment in a website. And over the years, we added a lot of resources to it, and it really had become unmanageable. So a couple of years ago, we received funding from the Council on Developmental Disabilities to redesign the website. And the new updated and redesigned New York Housing Resource Center launched in January of 2025. And so we encourage you to check it out. The redesigned website was developed with accessibility in mind. And so we had a good fortune of working with a web developer who had a lot of experience in accessibility. And so the color schemes, the layouts, the text choices really focused in that area. And there's other accessibility features built into the website as well that you can turn on and off depending upon how you want to engage the material. We also have a Google Translate plugin on the website, so you can translate any of the pages of the website into your preferred language. And then we also provide, let me back up. There's a significant number of video resources on the website, over 100, and we provide transcripts of those videos so that you can translate those or use those to promote accessibility to the content as well. I've referred a few times to resource categories. Right on the homepage of the New York Housing Resource Center, you will see 9 different tiles. These are our resource categories. Within these categories are over 45 unique topic areas. And within those over 45 unique topics, there are over 400 individual resources. Each resource has its own page on the website. So once you find something that is helpful to you, you can bookmark it, you can copy the link and send it to someone else, and you can share it so you don't have to try to find your way back to it again. Each resource has its own link. So just a couple things to highlight. I mentioned housing navigation. You'll find that under housing planning. I mentioned shared living or rental assistance. You're going to find that under housing types and funding. Also, we have some great resources under home ownership, which is everything from kind of introductory, general first-time home buyer resources or resources on housing counseling. And then we also have resources under ownership models that talk about, if I want to buy a home for my loved one, how can I structure it? How should I structure it? Can I buy a home and give it to an agency so my loved one can live there? Can I rent a home to my loved one? Those are all questions that we answer under home ownership and the topic ownership models. We also provide information on renting or buying under home ownership. So back in 2023, when we did some focus groups, we learned that a lot of people wanted information on whether they should rent or buy their home. And so we provide information there as well. Under support services, we cover things like CDPAP, self-direction services, transition stipends, so a lot of great information. Another interesting piece, we did a series called Living in Your Own Place back in 2020, and we've incorporated all of those resources under the Living in Your Own Place category. And that's where you can hear directly from people with lived experience in living independently, and they share their insights about that. Also on the homepage, we have a collection called Your Guide to Housing. And this is our central collection of 3 resources that provides our foundation for housing planning for people with developmental disabilities. It consists of 3 different resources: the Housing Journey Podcast, the Housing Resource Guide, and the companion piece to the Housing Resource Guide. The Housing Resource Guide is really our central resource in this collection. This is a 75-page guide on all things housing for people with developmental disabilities in New York State, and it provides a lot of information both on the types of housing, how housing is funded, as well as how to plan for housing. It was originally written in 2012 by our colleague John Mulpey when he was with the Westchester Institute for Human Development, and we've revised it several times since. It's currently only available in English. However, we've been working this year under our grant to work through an extensive readability edit of the Housing Resource Guide so that we can republish it in a revised format, which would be much more with improved readability than what it has now. And then we will begin translating the Housing Resource Guide. And so our goal is to have it translated to begin with into Spanish, Korean, and simplified Chinese. And so that's something we'll be doing through the rest of this year and probably into next year as well, so that we can offer it on the website in those languages. To complement the Housing Resource Guide, we have what's called the Housing Journey podcast. And this is a podcast that you can access anywhere you access your podcasts, whether it's Apple Podcasts or on YouTube or whatever the case may be. You can search for the NYHRC, A Housing Journey, and you can subscribe to our podcast. We have 3 seasons. The first season is a series of short audio episodes on the same topics that are available in the Housing Resource Guide. And so the host, John Mulpey, digs into those topics and provides an introduction to each of them. We also have a season number 2, with host BJ Stasio, where he talks about his lived experiences with living independently, his triumphs, his challenges, and different things that he's encountered along the way, including talking about technology and environmental modifications, how to work with a landlord if you need to modify your home or the apartment building. So a lot of great information there. The third season was hosted by Chris Liuzzo, and it focuses on person-centeredness and how we can center the person at the housing planning process and support them to develop a housing plan that meets their needs and allows them to live their best life. It's a great series there. We're also working on a season 4, which we hope to be releasing soon. Finally, the companion piece is the third resource in this collection, and this is really the workbook. It brings everything together. The chapters of the companion piece align directly with the Housing Resource Guide. It provides a summary of the material in the Housing Resource Guide. It will link you out to episodes of the podcast that align with that chapter's content. And then it will also provide you links to additional resources on the New York Housing Resource Center or other external partners where you can learn more about those topics. There's also a spot in the companion piece where you can record your key thoughts and takeaways. If you're using it on a computer, you can type those into text boxes, or you can print it and handwrite it, whatever's most convenient for you. This is also a resource that we plan to have translated into Spanish, simplified Chinese, and Korean as well. We're starting with the Housing Resource Guide, and then we'll tackle this project next. As I wrap up here, there's one other section of the website that's important to highlight, and that's the regional map. So if you visit the regional map page in the top menu of the New York Housing Resource Center, it brings you to a map of New York State, and you can select your region that you're interested in, and it will highlight a variety of resources specific to that region. These are often directories or search tools maintained by outside organizations where you can look for the service providers or the services or the organizations that support you directly in the area where you live. So you definitely want to check that out as well. That is our presentation on housing options and housing related services and the resources that are available to through the New York Housing Resource Center. So I hope you'll bookmark and share the nyhrc.org, begin to check out some of those introductory resources and the Your Guide to Housing collection. And then if you're interested in hearing updates on work that we're doing, maybe we're posting new resources or we're providing some free online education opportunities. If you're interested in those updates, you can sign up for our e-news mailing list, and that's at the footer of the website. So if you visit nyhrc.org and scroll all the way down, you'll see an option to sign up for that mailing list. So thank you. I think we're going to transition here to questions. As we do, there is a survey there on the screen. We are grant funded, and so our funders do ask us to collect information on these presentations and the work that we're doing. And so please, we can share that link, but also if you want to take a picture of that QR code and fill out that survey, we would greatly appreciate it.
Great. Seth, thank you. Very comprehensive. There's a couple questions that were in the chat that I think we were able to answer along the way. So just to kind of recap, in case you haven't been following the chat. One of the attendees had asked more information on the home enabling supports. So I put the link directly into the chat from the OPWDD's website. In addition, one of the parents was interested in learning more about attending the housing navigation course. So I also put the link directly from the New York Alliance website that talks about what housing navigation is. And then on the bottom of that landing page, you'll be able to sign up that you're interested in learning more. So once the next class occurs, which is probably sometime in the beginning of 2027, we'll reach out to you and share the registration link. Also, I put the direct link into the New York Housing Resource Center website. So you'll have that in the chat. And then finally, a question came in that Nick helped us answer, which was on personal care aids, and Nick provided us the direct resources associated with that.
Great.
So we have more of like 3 questions that are very much similar. So I thought we could talk a little bit about that. And it really goes back to a parent talking about their adult child being more physically and cognitively involved, and just little concerns that, what kind of housing options would be available to them. The one thing that, I'll certainly talk about and then pass it back over to Seth. Any type of housing discussion, housing journey really starts out with person-centeredness, to understand what the person wants, including, what the circle of support is thinking with regards to the person, but really spending deep time in understanding what is the person's desires for housing. Is it to live in the same community? Is it to have a roommate? Could they rely on technology as some level of support, and then really, leaning into the home enabling supports? So before even thinking about, the actual house, really spending some time in that journey of what is available. There's so many different types of housing options, the brick and mortar, and then you bring in the supports and services on top of those. So that's really our first foundational piece when it comes to a housing journey, and then building upon based on the person's needs. So if the home needs modifications because the person is visually impaired, then you bring in those levels of modifications within the home. Seth, anything else you wanted to add to that?
Yeah, I would acknowledge that is one of the central questions within the field at this time, right? How do we create or support housing options that meet more complex needs while doing it in a way that is not cost prohibitive long term, right? So, when the group home model, you could call it, some people call it, the traditional model, but it hasn't been around that long to be a tradition necessarily. When that was originally developed in the 70s, it wasn't there wasn't the thought at the time that people with developmental disabilities would ever live independently in their own place, right? Since then, we know that's not true, and there are many people with developmental disabilities who are living independently outside of the certified group home system. The certified group home system is also very expensive to maintain and develop, and it's not scalable for the number of people that will potentially need that level of service. So even within certified settings, people are exploring ways to provide that service more efficiently. So as parents, as caregivers who are thinking about the options for your loved one, as Carol mentioned, you really want to start with a really thorough planning process. And I'm not talking about, life plan meetings twice a year. I'm talking about sitting down with your team, the loved ones who support that person, the key community members, and people with expertise in housing and housing options to think about, what does this person need and where can they access that level of support? And it may be that the certified group home system is the right option for them, in which case you can pursue an application to be added to the Certified Residential Opportunities Protocol. But it may be that you can identify ways to provide that support within the community where they currently live, or a community where they want to live, or that makes sense for them, through a variety of caregivers. And so, as I mentioned, there are people with complex levels of need, both medically and behaviorally, that do live independently within an apartment, or within a duplex, or a co-op, or whatever the case may be, all across the state. And we've been able to show that it's possible for people with complex needs to do that. But it does take quite a bit of planning. And so those are looking at things like technology options, looking at different support services available through self-direction or through other agencies. And at the end of the day, that is where understanding the person and centering the planning on them and their needs you can then move into those different support services based upon the levels of need that exist. It is not easy. As a parent myself, I teach this, and sometimes I sit back and wonder, what am I going to do for my own son, right? And so even being an expert in the field doesn't mean that we quickly have all the answers. It does take a significant amount of planning and support, but it can be done.
Thank you, Seth. One other question that came in: for a person that have already received self-direction, can they also receive an OPWDD housing subsidy?
Of course, yeah. So the OPWDD housing subsidy is its own service. And if you are self-directing, then you typically would add that to your self-direction budget as one of the services that you budget for. If you're not self-directing, you can just access it independently by seeking out a provider agency who administers the subsidy as a standalone service. Now, the difficulty of that is that, from my understanding, and I don't have data necessarily on this, but there are a number of provider agencies who have limited offering this service as a standalone service outside of self-direction because of the complexities with administering it and the costs with administering it that were created when OPWDD issued the guidance ADM in 2022. And so there's been a lot of advocacy around how to improve access to this service. We do know that OPWDD has worked on a revised ADM and is currently reviewing it through some of their peer groups, and we're hoping to see that issued for public comment later this year. We've been hoping that for a while, though, but we have it. We're pretty sure that possibly later this year it's going to be issued for public comment. And so we're hoping to see some changes within that ADM that will create better access to this service. So just keep that in mind, that if you are not self-directing and you're looking to get an OPWDD housing subsidy, the list of agencies that are willing to do that might be much smaller than you would think. And so you will need to work with your local OPWDD regional office or with your care coordination organization to identify what agencies you would be eligible to apply for that service.
And Seth, a follow-up question: does that mean that the self-direction budget will increase by adding in the OPWDD housing subsidy?
No. So the budget for self-direction is determined by the person's DDP2 scores. That's the Developmental Disabilities Profile 2. And so that profile issues 3 different scores that are used within the self-direction budget to calculate their resource amount. And then it's determined by what type of budget they have. So they can have a residential only budget that excludes day and employment services. They can have an other than residential budget that excludes all residential services and only provides a small amount for day and employment. Or they can have a both budget, which covers everything. In either case, the resource amount for the person is not going to increase if they add the subsidy to the budget. It's just going to take up those budget dollars. So instead of using those dollars in a different service, they will assign them to the OPWDD housing subsidy.
Great. Thank you, Seth. I also just want to draw to your attention Nick Labruna from the New York Healthcare, put some contact information into the website or into the chat. There is one additional question, and let me kind of pull it up real quick. If somebody is under guardianship, would they be eligible for housing assistance in a non-certified living arrangement with their guardian?
Yes, so they could be. You would need to explore this a little bit. It does, sometimes landlords will require guardians to sign the lease, depending upon the person's capacity to do so. And so that is something that you will need to explore. But just because they have guardianship established, that doesn't disqualify them for the OPWDD housing subsidy.
Great. Thank you, Seth. Last question that just came in. Can individuals use the OPWDD housing subsidy to pay for co-op homeowners association fees or a condo tax?
So yeah, if someone's using the subsidy, then the subsidy is going to consider their housing costs. So that is going to be their rent or their mortgage payment, their insurance and taxes, and it could be additional fees as well, such as utilities and HOA fees. And so there are ways to capture those costs within the subsidy.
All right, good. Thank you for the emojis. Thank you. Seth, I think we've covered the questions.
That's
Thank you
one
for a
more
wonderful.
question. That's one more question coming.
Go ahead, Cindy.
That's one more question coming from Nia. If someone is under guardianship, would they be eligible for housing assistance, non-certified living with the guardian?
So I think I said that I just answered that having guardianship doesn't disqualify someone from these services. It does mean that when they're exploring housing, they're going to have to explore how to implement that if they don't have the capacity to sign a lease, right? And so that is going to take a little bit of planning and exploration to identify. Yeah.
Thank you very much. There anyone have any more questions? You can raise a hand or feel free to type your question in the chat.
And Cindy, while people are thinking, we didn't introduce Wei. So Wei, I don't know if you
Oh,
wanted to
yes.
open up your mic and introduce yourself. And I apologize for that.
It's okay. Hi, everyone. My name is Wei Zhang. I'm also the staff from Trans American Planning Council, as well as one of the housing navigator in New York City.
Yep. Wei's a nice resource to the community.
Yeah, I see there was another question added to the chat about trusts. Having a trust doesn't disqualify you from the subsidy as well. If the trust is set up correctly as a special needs trust, then it is a form of protected savings and doesn't disqualify you from the rental assistance that's provided by the OPWDD housing subsidy. But again, it must be set up correctly as a protected savings. So a special needs trust specifically, and there's different forms of those. And we have some information on the website as well under benefits and finance, where you can access information on special needs trusts. You can access information on ABLE accounts, which are protected savings accounts for people who are on SSI, where they can save over the $2,000 resource limit and that cap that's established by SSI through an ABLE account. So there's a lot of options there to talk about those different savings opportunities as well. Neither of which, having an ABLE account or a trust, would disqualify you from the subsidy. You would still be eligible for it because it would be based upon your monthly income, not those two resources that you have. Yeah.
There is a question in the chat. People are interested in your email address, if you don't mind adding that. Cindy, I really do want to thank you. We greatly appreciate this opportunity.
Thank you very much, Carol and Seth, for the wonderful presentation. There's so many information we learned today.
Recording
I think we will keep contacting you to maybe we do some research if other family want to learn more specific topic. So maybe we will reach out to you, yeah, to get more information. This is very useful. Thank you very, very much.
Yeah.
Yeah, thank you for
Yeah.
having us, Cindy. It's
It-
excellent.
Yeah, thank you so much, Seth. Thank you, Carol, for your time. And we would like to extend our sincere appreciation to you guys for your time and these valuable insights we shared in today's session. And we thank you also, Robin from OVWDD, for consistently providing us interpreters. And we truly appreciate that. And we thank you, all the interpreters, for your time today. And thank you, everyone who participated today. I'm sure there are a lot of things to take away. And yes, and most of all, to know where to go for resources. Thank you, everyone. Thank you.
Thank you.
And thank you,
Thank
Cindy,
you.
thank you,
Thank
Cindy,
you,
for
Chloe, for
arranging
participating.
this event. Yeah, thank
Of
you so
course.
much. Yeah.
Thank you,
Mhm.
Seth. Thank you, Carol. Thank you, everyone. We will
Have a
see
great-
next time. Thank you very much.
Thank you.
Thank you so much, everyone.
Sure. If anyone want the recording, you can type your email in the chat. I will send the email to you with the PowerPoint.
Cindy,
I
do
will,
you have
yes.
any announcement to make? I'm sure we usually do this at the end of the webinar.
Oh, yeah,
Any
if
like
there's
new
any other
program?
provider, right?
Yeah.
Yeah, you're
I am
right.
actually attaching here. Let me see if I can attach and here. Gosh, sorry. Oh, we have actually a concrete polishing program starting from August for age 16 to 24 years old. If you guys need to know more about it, I'm gonna put my email here. If parents wants to know more about it, you can reach out here. And I'm thinking actually to put the person's you can also reach out to me for any supported employment program. We also provide that. All right. Thank you, Cindy. Thank you, everyone.
Sure. Thank you. Bye. See you
Bye-bye.
next time.
See you. Bye-bye.
Bye. Thank you, Choi.
All right. Thank you. Bye.
Have a good day. Bye, everyone.
We can leave